in your community. That is somebody I wish I would have utilized. I thought because I was a nurse and that I knew things that, well, I don't need a social worker. No, that's not true. I think everyone, no matter how much your knowledge base is, you should get the social worker because she can intervene if something goes wrong. And a lot of times you're getting treatment in these big medical centers, and you need that person on your team to intervene on your behalf. So please, if you have the diagnosis of breast cancer, utilize the social worker. If no one talks to you about a social worker, ask, can I have a social worker? Okay, that's very important. I also want to talk about the plastic surgeon. The plastic surgeon, one of the most important persons on the team, because this is the person, this man or woman is not the general surgeon. This person specializes in plastic surgery. I want that to sink in. Excuse me. This person specializes in plastic surgery. So I actually have a breast reconstruction sheet to inform you what do you need to know from the plastic surgeon. Number one, I will recommend that your team, I named everyone on the team, the cancer doctor who looks at the cells and tell you what stage and what type of cancer you have, the oncologist, the general surgeon, the radiation therapist. I said the social worker, she is not on your medical team, but she's a part of the team, he or she, because she can look in the records and talk about insurance, what is paid for, what you're responsible for. These are things you don't look at. So think about the social worker as a member of your non-medical team. Now, the plastic surgeon, again, is the person who specializes in building or constructing you a new breast. And this is important because for women of color, for Black women, our outcomes are very low when it comes to plastic surgery for a lot of reasons. The three main reasons our outcomes are different than our European sisters are: one, I see in the literature written a lot, is lack of education. Number two, healthcare disparities. Number three, a lot of times we come in with in stage, the cancer is more advanced, so a lot of time this is not offered to the individual. So you got to do your homework, because if you're informed, you can make better decisions. Okay, so again, the plastic surgeon is the person you want to be familiar with. You want to make sure that the plastic surgeon is board certified. The next thing, you want to make sure that the plastic surgeon can give you before and after pictures. Ask him if he or she is familiar with doing surgery or reconstruction on Black women. Because our skin is different than our European sisters. And number one, if you have a history of keloids are where you have the skin heals, and the skin heals differently, and it is a raised scar. It's called a keloid. Some people choose to have that removed. Some people chose to leave that there. But if you have a history of these keloids, then this is something you need to let the surgeon know, because it can you can have poor healing of that tissue. Number two, in my case, I had increase in hyperpigmentation is what it's called, and the area did not heal well. Number two, it became infected, and that calls for I never got to the implant stage. I had a tissue expander, but I had hyperpigmentation, and I had that because I had diabetes. I was overweight. Not a good time to have an implant. We're going to talk about that in the next video, and that is going to be what is an expander, what can you expect when you have an expander, what are some of the pros and cons with having an expander, and how does it relate to Black women specifically? What are some of the challenges as far as if you are pre-diabetic, diabetic, you have these comorbidities, then it's going to affect your outcomes. You want to understand this coming in because you'll know how to face these challenges with the understanding that I did not have going in, because I could have waited and got myself together. My numbers could have looked better. My outcome would have been differently. So listen, we're going to learn together, family. I want you to come back in the next video and we're going to talk about an expander, what an expander looks like, and what to expect, and how you can prepare yourself better. Thank you for sticking with me. Please stick around for the next video. This one is running over 11 minutes. The next one won't be so long, but I wanted to do a reintroduction back into talking about this issue of breast cancer, because the data is clear that Black women are not getting the reconstruction they can have. They're less informed and less educated. We're better together, family. We're better together. Thank you. God bless. Peace.